My name is Philene Krogel, and I am a mother of 2 boys. My husband and I just moved here from Michigan, outside of the Detroit area, and we love it. We think that this area has been a phenomenal change for us. I'm more of a cup half full type of person anyway, but I feel like this area is just absolutely perfect. The climate, the people, the terrain, it is just outstanding. I went to college at Bryan College in Dayton, Tennessee, and then I decided at that point I really wanted to pursue a career in medicine. I did an undergraduate in biology, and from that point on went to medical school at Lake Erie College of Osteopathic Medicine in Erie, Pennsylvania, and that was a change. It was a very difficult climate from a Florida girl. I'm originally from Florida. And it was very difficult to find my car at times because of the high amounts of snow. But I found that it was a very good place for an education because you couldn't do much else other than study. So it was wonderful. As an OBGYN, I focus on all realms of female issues, anything you can pretty much think of, from infertility all the way to menopause and everything in between. High-risk pregnancy issues and low-risk pregnancy issues are all part of my training and part of my background. I've been working for 2 years as an attending in Michigan, and I've definitely seen and experienced a lot in regards to women's health. As far as specialty training, I am surgically trained more in the minimally invasive aspect. I do procedures to try to avoid having women in the hospital for multiple days at a time. We're now in a day and age where we can fortunately have procedures that you're inpatient for so many hours during your surgery, and then you get to go home that same day. And that's including taking out large ovarian masses, that's including taking out a uterus for a hysterectomy. It's pretty amazing what we can do now, and that is part of my training. Being a mother of 2, I find that I have a very intuitive approach to pregnancy. My mom herself had 5 kids. I was the second in line, and I got to take care of my younger brothers and sisters for a long time. The best way that I can help my patients is by putting myself in their shoes, or acting like they are my family, and how would I take care of them in that pregnancy. I work at Women's Health Group, and it's a wonderful practice, a very cohesive practice amongst the staff and my colleagues. And I find that that is so helpful for not only the staff, but also for patient care, when you have a very cohesive environment and a well-organized environment. There are so many different ways now that we have in women's medicine for preventative care. And it's very sad because a lot of women, they get so scared about coming to a physician, especially a gynecologist, because of the nature of the sensitive exam, that they don't come for those preventative screenings. Specifically with cervical cancer screening, with pap smears, and with breast cancer screening, with mammograms. It is remarkable how specific and how sensitive those tests are now to help prevent those cancers. And if women don't come for those tests, we tend to find them later on down the road where the cancer has grown to such a point where we may not be able to do much to help them. So it is very important for women to come in for those screenings. And then for other female cancers such as uterine cancer and ovarian cancer, which we do not have very good screening tools yet, it's important for a patient to come in and talk to their physician about their signs, their symptoms, because we may know what can clue us in to do more invasive testing for that patient. Specifically for cancer screening, if we're talking about cervical cancer screening, a lot of times we want to put that into a box and say there's a black and white answer as far as when you should start screening. The general age now is 21 years of age to come in. However, if a woman starts to become sexually active, she does need to come in at that time to talk with her healthcare provider, because there are many other conditions that need to be explored to help to protect her in the future from certain diseases. So even though the current age for starting cervical cancer screening is 21, I would absolutely advocate a patient coming in as early as if they start having problems or if they become sexually active. I think that being a female OBGYN is something that I can in some cases offer just a different perspective. You know, a lot of times we use the analogy of if a female is going to a male OBGYN, they don't understand. And I don't necessarily believe that philosophy, because I believe that a cardiologist may not have ever had a heart attack, but still they can be a very good cardiologist. I feel that because I'm a female, yes, in some cases I can be more empathetic and sometimes even more sympathetic with certain conditions. However, I really don't feel that just because I'm a female, I'm going to be a better physician. I feel that if you find that I am well trained in my field, that is what really should be the drawing in the sand. I think the number one thing that sets a good physician apart from the rest is if we treat our patients as if they are family and as if they are truly a fellow human being.